And good morning. I am Professor Dr. Samar Banerjee. I am attached to the Institute of Medical Science. I am presently the President of Association of Clinical Diabetology. I was earlier the President of Indian Society of Hypertension, Research Society Diabetes India, and now I am in the policy making for the Indian policy for hypertension guideline. Today I am going to discuss the salient points about the role of diet in young hypertensive patients. Earlier you used to know that the hypertension is a problem of elderly people, but nowadays because of altered lifestyle or altered habits, more and more people are developing hypertension at very younger age and very short time. At the younger age they are becoming incapacitated, and hypertension leads to cerebrovascular accidents, then coronary artery disease, renal failure, etc. etc. Beyond the drugs, what the people should know, what they can do of their own, is about the dietary changes. High blood pressure is when your blood pressure is high. You consider 140 by 80 maximum. I should rather label it as 130 by 80 as a normal pressure. Above that, when it is more than 180, then we should go for starting drug. Before that, we usually practice non-drug treatment, and that consists one of the diet, another is the exercise. To first concern, you will have to focus on the salt intake, second on the fat, third on the total calorie what you are taking. Alcohol consumption, it should be moderate, less than 30 gram of ethanol per day, restriction of caffeine. If you follow all this, it will help lowering blood pressure, avoiding complications and also less use of the antihypertensive drugs. Multiple trials have shown that diet and exercise itself can reduce blood pressure in 24 to 55% of cases in different trials. Regarding the diet, the first point what you will have to highlight is the consumption of salt, common salt. The common belief is if I fry the salt, it will be less sodium. The answer is no, it is more concentrated. Salt remains salt whether you keep it as it is or even you dry or fry it. And the recommended intake of salt or sodium, if you take as a sodium, it should be less than 2.6 gram per day. As a salt, 5 to 6 gram, that means only 1 TSM including your diet, and this do not allow you to take extra salt in any of your food item. If you take less salt, then blood pressure will be controlled and you will have a better result. So what you will do? You read the food labels when shopping. Look for low sodium version of foods and beverages. Eat fewer processed, canned and packaged foods. Use salt-free seasoning. If you need to use salt with cooking, add it at the end. And trans fat, regarding the dietary fat, if there is more unsaturated fat or trans fat, chances of coronary artery disease, hypertension and cerebrovascular accidents, renal failure, eye damage, blood clotting, etc. are all higher. So try to limit the unsaturated fats as far as possible. And what you can do, eat more fruits, vegetables, whole grains, low-fat dairy product like poultry, fish and nuts. Use naturally occurring unhydrogenated vegetable oils such as canola, safflower, sunflower, olive oil. Look for processed food made with unhydrogenated oil rather than partially hydrogenated oil, and cookies, donuts, crackers, muffins, cakes, etc., which all use unsaturated fat, should be avoided, and try to limit fried foods and use more baked or boiled food. Regarding the junk food which has attracted the notice of the young people, like the soups, sandwiches, pizza, potato chips, cheese, food items, they are high in sodium and also the fat. They should be as far as avoided and at least limited. And sugary foods might aggravate high blood pressure because sugar not only raises the blood sugar, also the sodium. And on the reverse, I will say if you take excess salt, then the blood sugar also is increased together with the blood pressure. The best remedies are Fried food requires the most sodium to enhance flavor, which increases blood pressure level. Fried things, more oily things are tasty, but it is damaging your system. Having a piece of fruit, yogurt, nuts or some crackers and cheese in your bag or the fridge will stop you from grabbing something less healthy on the run. Always try to use a water bottle and try to take cold water than the mixed or chemically mixed soft drinks, fruit juice, sports drinks, etc. A nutritious breakfast with more fruits and vegetables will help you. Swap a chocolate bar to a nut bar or a handful of nuts. Swap a bag of chips to a bag of unbuttered popcorn. Try to use minimum amount of the salty or oily biscuits. Go for plain biscuits and take more fruit, oats and less sugar. Next point you should keep it in mind, your diet should be also low fiber, not be low fiber, it should be in high fiber diet. High fiber lowers the sodium, lowers the blood pressure, lowers the blood sugar also, and for that reason you will have to take enough of fruits and cereals. So for breakfast choose a high fiber breakfast cereal, consume at least half of all grains as whole grains. Substitute whole grain flour for all the white flour when baking. So take lal atta, then the maida. Beans, peas and lentils are excellent source of fiber. Take enough amount of fruits and vegetables which are rich in fiber, not only but vitamins and minerals. Try to eat 5 or more servings daily of fruits and vegetables. In conclusion, you know the junk food are tasty, easily available and very attractive, but they are doing more damage. So please avoid to conclude that eat less saturated fat and total fat, get plenty of potassium, fiber rich food, limiting the amount of sodium and junk food in the diet can help to reduce the burden of blood pressure and related complications. Together with limit alcohol intake, total ethanol less than 30 gram, limit cigarette smoking, and limits also the use of caffeine, that means coffee, etc. Thank you for your patient hearing. This will help the young generation to prevent hypertension and related disorders. Thank you.